that lets you save.
Our most common things are things like back pain, which is really common, headaches, but our others, we do a lot of things for digestive systems as well, but people tend to come and see us because they've tried everything else and nothing else has seemed to help.
Welcome to Exploring Mind and Body with Drew Tadia. Drew is an expert in nutrition, fitness, lifestyle, and more. And he wants to help you live a healthier, longer, and more active life. Now here's your host, Drew Tadia.
Welcome to another edition of nationally syndicated Exploring Mind and Body. Thank you so much for being here. Thank you for tuning in, for being a part of our True Form Life community. We're coming at you with a brand new show. We appreciate whether you're listening on terrestrial radio across the country or as a podcast around the world. We certainly wouldn't be here without you. So stick around. We got all that coming up.
This is Exploring Mind and Body. Naturally improve your lifestyle one show at a time with your host, Drew Tadia.
All right, welcome to another edition of nationally syndicated Exploring Mind and Body. You heard all about Christal in the introduction, so without further ado, welcome to the show, Christal.
Thank you, Drew. Thanks so much for having me today.
It's our pleasure. Today we're talking about osteopathy. I got to tell you, that was a tough word for me to say for quite a while. Do you get that a lot?
Yeah.
So tell us, we're going to jump into the show here. We got lots of questions and conversations, but tell us about who you are and what you do.
Well, I'm Christal. I'm a certified athletic therapist and osteopathic manual therapist. I went to school in a small town in Saskatchewan, and I was an avid athlete, and I hurt myself a lot. And lots of repetitive strain injuries with shoulder. Everything I did was an overhand sport. And in my small community, the doctors didn't have much to tell me about what was going on, and they basically said, you need to rest. And that didn't go well for me. As a very active individual, rest is one of those things that's really difficult to do. And so there was nothing for options in the community I grew up in. There was nothing for any type of thing other than medicine. And so when I went to school trying to figure out what I wanted to do, my guidance counselor suggested I try athletic therapy. And I thought, oh my God, that sounds awesome. So off to Calgary in Mount Royal College at the time to study athletic therapy. And I fell in love. I'm like, oh my God, this is where I need to be. And it was super awesome to learn a lot about what I did and how to prevent myself from getting injured in the future as well. And then I went out into the real world and did some work, and then in true fashion hurt myself again and needed knee surgery. And during my time off, I ended up from the clinical practice that I had, I needed another job, and I got a job in the insurance world working with people that had been in motor vehicle accidents, and learned about the insurance world. Eventually got a job in a rehab position in a major insurance company in Canada, and learned a lot about what was going on in the world of insurance. And a lot of people had unexplained pain. There was nothing wrong with them in any of the testing that was done. And so it was really interesting to me, how can people have all this pain but nothing be wrong with them? And so I started doing some research and found osteopathy. And I started looking into it, and I found that, started studying it and realized that I was where I needed to be. I could learn so much more about the human body and what it was about and how it interrelated and how people can have pain, but not actually anything so-called wrong with them in the medical world. And so that's kind of where things took off.
So, okay, maybe you can help us differentiate. So there's athletic therapy, and there's physiotherapy, and then osteopathy. So why did you do athletic therapy instead of physiotherapy, and or what's the difference?
I actually was accepted into a phys ed degree program at the University of Saskatchewan, but I grew up in a small town, and everyone was going to the University of Saskatchewan, and I wanted to be different. That's why I went into the athletic therapy program, because it was in Calgary. But there is some differences. Athletic therapy is a little bit more of a niche in the sense that we not only learn the clinical side of sport therapy, we also learn the emergency side of therapy. So we're on the sidelines of various different sporting events, and so we learn emergency care as well. So we know how to, put a kid on a spinal board if they've had a spinal injury, and how to remove helmets and all that kind of stuff as well. In the physiotherapy world, it's more of a clinical state, and you actually have to do extra studies in their sport physiotherapy program to learn the emergency side of things. So it's very similar but different. We don't work with cardiorespiratory. We're really only musculoskeletal in our approach in the athletic therapy world versus the physiotherapy world.
Okay, and now osteopathy compared to the other two.
Osteopathy is really quite different. Osteopathy is a global look at the whole entire body, and it's based on a finite palpation skill. So it's a skill that you develop over time that helps you feel the body in actually a different way. So you learn to feel where the tensions in the body are coming from. So I can put my hands on various places of the body and I'll feel tensions in the body and can identify where that tension is coming from so that I can release that. As an athletic therapist, if you came in with a knee injury, I was assessing your knee, what was wrong with your knee, and then prescribing exercise and stretching and applying various different electrical modalities for pain management, things like that. In more of a streamlined kind of protocol, you focus on pain management, then you work on range of motion, then you work on strength, then you work on return to sport activity. Whereas in osteopathy, whatever you show up with today in your body is what we're going to work with. So whether it's been just injured or chronic injury, I'm not really concerned about where your pain is. I'm concerned about finding out why do you have your pain. So even if it's an acute injury, it's not so much as to why do you have that pain, because it's pretty obvious. It's more of what led you to or precipitated you to a level that you could be injured in such fashion.
Okay, so what are some of the main reasons people come to see you as an osteopathist? Is that right? Osteopathist?
Osteopathic manual therapist. That's what we call ourselves. Although, yeah, osteopathist would be a good title too. Typically, people are coming to see us. Our most common things are things like back pain, which is really common, headaches. But we do a lot of things for digestive systems as well. But people tend to come and see us either because they've tried everything else and nothing else has seemed to help, or they've been referred by someone who's like, oh my God, they've done magic with me. You got to go see them, kind of thing. So pretty much anything under the sun is what we see. But typically, for most people, the back pain or the shoulder pain or headaches or things like that are very common.
Do you have a favorite thing to work on, or is it you just enjoy all of it?
I really enjoy all of it. The beauty of it, I think, is that you can have people come with the exact same thing. They might have the exact same type of back pain, but their reason for why they have back pain is generally not the same. You'll see some similarities, but it's a puzzle. Every person is a puzzle, and their history and all their experiences in life determine what leads up to their challenges. And so it's like putting a puzzle pieces together to find out why.
So when first time someone hears of osteopathy, how can you explain it? Maybe some of our listeners have never heard it or tried it or experienced it.
I liken it to we're crime scene investigators of the human body. So our job is to, your pain is the victim. We're trying to figure out who caused it, who done it. And so
and what does that look like? So you're like so different than, there's many different modalities like chiro, for example. They're hands-on, they're touching, they're cracking.
This is all hands-on therapy. And actually a lot of therapies that you hear today actually stem from osteopathy. So chiropractic, cranial sacral therapy, myofascial release are all components of osteopathy. Our chiropractors have refined their skill in slightly different than the osteopathic method and so on and so forth. But we are taught on how to do pretty much all of those modalities. They just started in osteopathy. Osteopathy started back in the 1800s, founded in the US actually by Dr. Andrew Taylor Still. So it's been around for a very, very long time. Sadly, not everyone knows what they are.
And then you said we have listeners from all over the world. Do you want to speak at all on how it's different from Canada, the US, possibly Europe?
Yeah, for sure. So in the US osteopaths are physicians, so they're osteopathic physicians. So they study medicine at an osteopathic college. Everywhere else in the world, we're considered manual osteopaths in the sense that we are not medical practitioners. We are taught in the manual therapy side of things. So in many countries, osteopathy is actually regulated. So there's a regulating body based on the government. And in Canada, currently, we're not regulated. So in technicality, pretty much anyone can call themselves an osteopath or an osteopathic manual therapist or osteopathic practitioner. But in Alberta, the College of Physicians and Surgeons owns title to osteopath. So you'll typically hear in Alberta, they'll be called a manual osteopath or osteopathic manual therapist. The education in Canada is all over the place at the moment. You can study online for 6 months and become an osteopathic manual therapist, or you can study at a more recognized college. And usually those programs are 4 to 5 years in length. They're postgraduate programs in Canada, being that you've had to have had prior training. So my athletic therapy training allowed me to study it. And it's a 4 to 5 year program part-time with examination processes throughout the process and a capstone project. Mine was a thesis that I defended in front of a jury. So
tell me about that. What is that?
Well, I did a research study on, in particular, it was vestibular disturbance in post-concussed active individuals. So I had, it was a random controlled trial where I had people that had sustained a concussion and had specific criteria to meet that, and they had to be post, 30 days post concussion and still having symptoms and so on and so forth. And vestibular disturbance had to be one of them. And then I had a control group that I didn't treat to see the difference of if osteopathic care could make a difference in their symptoms. Then I had to get in front of an osteopathic jury to present my findings, and I successfully defended it. So I was able to call myself an osteopathic manual therapist.
So if you didn't successfully defend it, they would say, sorry, yes. Try again.
Yeah, pretty much, yeah. Yeah, exactly.
Okay, so something lower back is always an issue. It comes up everywhere I go. What I know it's difficult. I know it's really difficult. Anytime I talk to a practitioner, especially hands-on, every case is different. But what can you tell our audience that's listening that might be beneficial to people that struggle with that?
The interesting thing for the most part about back pain is, and the most common thing is that a lot of people have back pain, but actually don't have dysfunction in their back. It's usually adapting to something else. So very, very commonly, I'll see a lot of ankle issues, like previous ankle sprains and so on and so forth, in which they've probably healed just fine, but they just don't have the proper mechanics and motion within the foot and ankle. And so it's not translating the weight through the body as efficiently or as properly as it should. And so there's various parts in our body where the horizontal becomes the vertical, and our back from the pelvis up into the spine is the same kind of process. So that all the stressors of the horizontal from walking are translated vertically through the legs, while at the hips you go through the pelvis and then through the spine, you have that horizontal to the vertical again. And so when you can't absorb it properly in the foot, you're going to see the same kind of mechanical challenges occurring in the back. And so often people will have back pain as a result of dysfunction in their ankles.
That's very interesting. Okay. So that's something that could be of concern for our listeners that might have back pain. You got to check out your ankles too.
Yeah. And the other thing too is that we have a lot of organs, all of our organs attached to something. And they attach to our spine and to our rib cage in various places. And therefore they can also create a lot of challenges within our back as well too. So we forget that those things are in there sometimes. Sometimes I wonder, actually, when I started studying osteopathy, I've studied anatomy for many years, and it's like, what did I think happened with our organs? Are they just free floating? Like, what is this for? Right.
Well, you don't think about that, right? Like, that's what I think. I think they're just hanging out in there somewhere.
Exactly. But they are attached to us, right? They're attached to the actual container. That's the contents. They're attached to the spine as the container. And so we forget about that sometimes. And so that's what we do look at.
So you're able to see the organs or feel them from the outside?
You betcha. So we have techniques and ways to assess the mobility. So organs are very similar to all of our joints. They have attachments, and therefore they have motion. They have mobility. So they will flex and extend or side bend and rotate, just like all of our other joints have the capability. So each organ, like each joint, is very different. So we can assess their mobility on their axes or their attachments to see if first the actual mobility is there, and how much the mobility is, and so on and so forth. And through our hands are able to, and positioning of our hands, but also positioning of the client can help and do some visceral manipulation and change the position and mobility of the joints of the organs, I guess, for lack of a better way of describing it.
Give me a couple examples, like what organs can you feel? Like, give me a couple other ones.
All of them. Liver.
You can feel the liver. Okay.
The liver is a really, really large organ. And we can, with hands right underneath the rib cage, you can actually physically feel that. And through motion with the body, like I can test and see if there's rotation or side bending or forward rolling or backwards rolling. And you can actually feel it. And clients will feel it. When you've got a liver that doesn't want to rotate, like their whole entire body, if you've got their liver in your hands, their whole body stops moving because you've got the liver in your hands. They can't actually do that rotation.
Now I want to poke myself to see if I can touch my liver.
Well, and we can feel the heart too. And this sounds kind of crazy. Like, how do you feel through the sternum? And this was a really large challenge for me as a student. Until one day we're learning actually about the sternum and its movements and mobility. And I can't feel the sternum. All I can feel is the heart. I'm like, how is this possible? And this particular student that I was working with in this class had a heart issue. So all I could feel was her heart. So as soon as the instructor came and did the little correction for the heart, and then I could feel the sternum again, I was like, oh. The other thing that's really interesting, I've done a number of post-grad courses on endocranial spasms and working with the brain and the spinal cord. And it's really cool to feel the difference, but it's also what I love about it too is that I can help clients feel the difference too. So I can show them what it feels when I'm on their head, but I can show them what it feels like when I'm on the brain, and they can feel the difference, which is super cool.
What are you doing? What do you mean you're on their head? What's happening there?
Well, we can get spasms. So just like we can get a contusion in a muscle, and that's kind of what the spasm, a traumatic spasm on the brain also kind of feels like that when you've got that big, hard contusion. The brain actually has that same thing that happens when we have a concussion or a bump to the head and things like that. So, but just like everything else, the brain also has an axis of motion. Each, like the cerebellum and the cerebrum, they all have axes of motion, and we can lose those axes. And so we need to be able to have regain that axis and regain the motion of the tissue on that axis as well. And so that's really what we're doing.
Okay, so you just mentioned the spine, and then lower back issues have come up. What if there's some damage? I know there's a number of different ways, like a bulging disc, herniated disc, and then we hear from a lot of people that have sciatic issues. Is there anything that you do or recommend when that comes up with your clients?
Yeah, for sure. Obviously, it's all dependent on what we find in their body as things that are not moving, because usually the body's trying to adapt to something that makes changes that actually result in injury. So a disc injury, for example, pretty common to see a liver that's not moving properly. And it's pretty common to see a diaphragm that's locked down. The diaphragm attaches all the way to L1, 2, 3. And so if you're locking down those lumbar vertebrae, L4, 5, S1 has to do a lot more work. And so if it's doing all the work of all 5 vertebrae, then there's more chance for it to develop challenges and problems. So the small intestine and how it attaches, the sigmoid colon and how its fascia attaches into the spine as well, and the posterior abdominal wall can lead to those types of things as well. Also, I mean, obviously can be dysfunction in the mobility of the pelvis too that can lead to those challenges as well, but they could be a multitude of reasons. So our whole thought process and how we look at the body is clearing up the things that are not moving the way they should be moving, so that it takes the pressure off the tissues that are struggling or have the symptoms.
So I was doing some research, and it seems like a lot of people are in chronic pain. Is that something that I feel like there's a difference? Like some people deal with that on a regular basis, and I don't know, you have to accept that maybe, or some people are able to. Does it depend on the individual, the injury, the issue?
Yeah, I mean, it's so multifaceted. Unfortunately, there's not a one-size-fits-all scenario in any case. But I've had a lot of clients that have come in that have a post-motor vehicle accident. They're 20 years post-motor vehicle accident, and they've just been told, I have to live with the pain. But the reality comes down to, if you get a number of things moving, their body can move towards healing itself, and their pain can go away. Now, it's not going to be in every case, but I've had a number of cases in which they've literally been told they'll have to live with it it for the rest of life, and they're now pain-free. So yeah, every case is obviously different.
Yeah, that's nice to hear though. Like some people I honestly hear it all the time that people are just in pain and they don't have any answers, and like the doctor doesn't really say anything. Here's some medication. You know how that goes.
Having studied, like if I look at the medical world or the insurance world, we're relying on a lot of things in medicine. We're relying on our different testings, our diagnostic testings, our imaging to provide us all the information. In medicine nowadays, we're not relying so much on our hands. There are doctors that are really amazing and they do their hands, they use their hands and they assess really, really well. But a lot of stuff, especially nowadays when we're doing them by like this way, we're having these appointments over the phone. There's no touching, there's no hands-on evaluation. So we're not seeing some of those things.
And so it's really, I'd imagine it's quite difficult to, assess without actually seeing your patients or clients.
Yeah, it would be, right? Like you can ask someone to go through and show their range of motion, their shoulder through this motion, through a Skype visit, but you don't get to see necessarily the quality or the movement, or you don't feel what's happening in that joint when it's doing it. And so it becomes a little different to really assess. But we really literally our hands and the sensation that we get from our hands of where the tensions within the body lie are our directors, and they tell us where we're going and what we're doing.
Help us manage our expectations. Of course, again, everyone's different, but if someone were to come in to see an osteopath, you're looking at when would you see it? Everyone's different, right? But
yep.
Does it take a number of sessions? Does it take weeks, months? When would someone expect to come in and see some difference?
It's pretty amazing because it's so hard to determine for sure. I've had some people where they've come in and after one session, they're like, oh my God, I feel like $1 million. Like, what did you do? Right. I think it depends a lot on what they're doing outside of what they're doing to see you, their diet, their lifestyle. People that are in pain, if they're doing nothing for their pain versus people that are doing lots of things for their pain to try to help manage, you might see them recover a little sooner because they're doing a lot to help themselves, and it's just might be a couple little things that need a little fine tuning and off they go. Whereas some people, it's a lot more. There's a lot to. It's like unwinding like layers of onion. You have to get to the various different layers. It might be something from childhood that's creating their challenges that they have now, but you have to unwind all of the adaptations that have happened in that time frame to assist with that. How much stuff have they done over their lifetime? If they've been in multiple motor vehicle accidents, or some people go to their grave in pristine conditions, other people go to their grave having used their body, right? It's the same idea.
Right. Well, tell me how it's going at the clinic, or tell us about your clinic. Maybe our listeners probably don't know.
So my clinic is Take Flight Osteopathic Wellness in Olds, Alberta, Canada, and we have a couple of osteopathic manual therapists. We have a couple of massage therapists, one who's also a student in osteopathy, and then we also have a yoga movement therapist. So we try to we're really all about trying to figure out why the symptoms you have are going on, and try to figure out why, so that you can actually overcome those symptoms. And so we offer osteopathic care, and we're the only ones in central Alberta between Airdrie and Leduc with our level of education. So that's really exciting for me. And we also offer a really unique program, which we call our functional osteopathy program, which is a 2 therapist, 1 client approach, where we use osteopathic care and functional movement. So not only we're trying to figure out what structures within the body are preventing you from moving and functioning the way you need to, it's also what dysfunctions are in the musculoskeletal system. So what muscles are not firing or firing on behalf of something else to allow you to do the movements that you want to be doing. So it's kind of a really unique program.
So what is that? You have 1 patient and 2 practitioners?
Yeah.
That's pretty cool. You feel like royalty. Is it the same time?
Yeah. What do you mean same time?
Are the 2 practitioners that they're working on the same time?
Yeah.
Oh, that's cool.
We work together. And what we're seeing is that the results of that are probably equivalent to one functional osteopathic program is equivalent to about 4 sessions, either with myself or with Yvonne Workman, who's the yoga therapist. So you take home, we clear up some of the things that's preventing you from moving within the system, and then teach you exercises and give you a take-home program to work on the rest on your own in between sessions.
Tell me about insurance for our people.
For osteopathic care is covered by a lot of insurance companies. Of course, just like most things, not everyone covers everything. So it's not under absolutely everyone's plans. But for the most part, osteopathic manual therapy is under the majority of the insurance. If you're looking at Blue Cross, it's typically in their higher end Blue Cross plans. But your typical like Manulife or Great West Life or things like that, they're typically covered.
So what is that under? Like, so usually it's like chiro or physio. It's in its own osteopathy.
Yeah, so it'll be under your paramedical services, just like physio and chiropractic and massage and so on and so forth. It's listed under those, and it usually has its own category as osteopathy. Gotcha. And then people have the healthcare spending accounts, which should cover it as well.
Right. So do you see teachers?
I have a few teachers.
And the teachers are a bit different. So they have like a health spending account.
Yeah, no one has actually indicated that they haven't gotten coverage for osteopathy in any of the teachers that I've seen, but so I'm assuming based on that they have coverage.
Okay. Yeah, you probably don't know. Like, you don't see their plans, right?
No, exactly.
Okay, just curious. It's nice to know when people go in if it's covered or not, right? I think
For
some
sure.
people ask. Are the majority of your people, they go through insurance, or is that
There's
separate?
quite a few that do, and a lot of people we live in a rural farming community. A lot of people don't have insurance either, too, so they just pay out of pocket.
Yeah, okay.
Yeah.
All right, Christal, before we wrap things up, is there anything that we missed that you wanted to cover?
Oh, there's just so much. I don't know if you can get it all in one interview by any means, but I guess the big take home for me is that we base our work is really based on principles instead of protocol. And the primary idea is behind it is that one, structure governs function. So if the structure is not the way it was intended to be, I'll give you an example of a bone. When a bone doesn't have the right amount of fluid in it, it reacts differently. It would be similar to a branch that is dead, that has no fluid in it, to a live tree branch. The dead tree branch will snap, whereas there's flexibility in the live tree branch. And so that determines how the structure is going to function. So if you change the structure, you change the function. So our goal is to first off make sure that the structure is doing what it's supposed to be doing, so the function can be there. The second one is that the rule of the artery is absolute. So the movement of any fluid, it's not just our blood, but any fluid in the body needs to be moving. So it needs to be nerve fluid, lymphatic system, etc., the whole kit and caboodle, in order to have normal function within the body as well. And we're all one large functional unit. We can't separate one component out and expect the body to still function in the same fashion. It just doesn't work that way. And then our body is really capable of healing itself. So once it has the freedom to move the way it's supposed to, the body will unwind and start and move towards improved health overall. So those are the big, I think, things that in osteopathy we really try to make sure we're focusing on, as instead of following a particular protocol as you'd see in various other health professions.
More of a holistic approach. I like the idea of it's your whole body's. In most cases, you treat one thing, right? Like you treat your finger or your wrist or your, instead of treating the whole body.
Well, and that's funny. I often treat fingers and toes, and people are like, why are my fingers and toes? I'm like, well, it's part of your body. It's really, you use them every day.
Right. You take those things for granted until you lose the ability, and then you're like, oh, I use my thumb with everything.
Exactly.
Yeah.
And it's still connected to the rest of you, right? Yeah.
So before we wrap things up here, Christal, tell us about your clinic. They can call you, they can email you. Do you have anything on your website?
Yeah. So you can go to takelightosteo.ca. That's our website. It connects you to our booking site. You can email us at store@takelightosteo.ca, and you can call us at 403-556-7505.
Awesome. So if they want more details, they can just reach out to you. Maybe they have some more questions, or if they're local, they can check out your availability on the website.
Yeah.
Okay, awesome. Thank you so much, Christal. That was fantastic. I appreciate your time.
Thank you, Drew. That was very enjoyable.
True Form Life.
All right, that's going to wrap things up for this edition of Exploring Mind and Body. Once again, thank you so much for being here. Thank you for tuning in and being a part of our True Form Life community. You can always find us on facebook.com/trueformlife. We post up there a couple times a day on our story. We're always trying to bring you more content around living a healthy lifestyle, whether that be nutrition, fitness, lifestyle, and more. We also have free challenges that we do at least once a month. So if you follow us along there, you'll be able to join maybe a plank challenge or a squat challenge, Tabata challenge, whatever it may be. We'd love to have you join us. We're also on Instagram.com/DrewTadia. Again, we're posting up there a couple times a day along with our story, all dedicated to keeping you fit and healthy and on track. Our main website is trueformlife.com. If you want to check out some of our products, some of our services, or if you just want some great content from videos to blog posts and recipes and more, we got all that at trueformlife.com. Once again, thank you so much for being here. That's it. That's all I got. I'm out of here. As always, I'm your host, Drew Tadia, in health and fitness for a better world. Thanks for listening.
You've been listening to Exploring Mind and Body with True Form Life's Drew Tadia, fitness expert. To find out more about the show, Drew Tadia, or to listen to past shows, visit exploringmindandbody.com.